Why use the four-quadrant approach for ethical decision-making? When faced with tough choices in healthcare, how do professionals decide what is best for patients? The four-quadrant approach offers a clear and organized way to tackle these ethical dilemmas. This method helps break down complex situations into manageable parts, making it easier to find balanced solutions. First, let's look at the quadrant that deals with medical indications. This area focuses on the clinical facts, such as diagnosis and treatment options. It evaluates what medical interventions are appropriate and beneficial for the patient. Here, the principles of beneficence, which means doing good, and non-maleficence, which means avoiding harm, come into play. Next is the quadrant for patient preferences. This aspect considers the patient's autonomy, which is their right to make informed decisions about their care. It examines whether the patient understands their options and what they wish for regarding treatment. Respecting these preferences is vital in ethical healthcare, ensuring that care aligns with the patient's values. The third quadrant is quality of life. This area assesses how different treatments will impact the patient's overall well-being. It looks at physical, psychological, and social factors. This helps weigh the benefits and burdens of interventions, supporting the principles of beneficence and non-maleficence by determining if treatments improve or harm the patient's quality of life. Finally, we have contextual features. This quadrant considers the social, cultural, legal, and economic factors that can influence decision-making. It incorporates the principle of justice by recognizing the broader context in which care occurs. This includes family dynamics and cultural beliefs that might affect treatment choices. Using the four-quadrant approach helps healthcare providers and ethics committees navigate ethical dilemmas in a structured way. It makes it easier to identify conflicts and prioritize values. This method supports shared decision-making by combining medical facts with patient values and contextual realities. Practically, this approach clarifies complex ethical issues in clinical settings, especially when treatment decisions are challenging. It balances competing ethical principles without favoring one over another. It also provides a common framework for healthcare teams to discuss and resolve ethical challenges. Moreover, it enhances patient-centered care by explicitly including patient preferences and quality of life considerations. Addressing legal and cultural factors ensures that care is respectful and appropriate. Overall, the four-quadrant approach aligns with foundational bioethics principles that guide modern healthcare. It offers a practical, principle-based method to support ethical clinical decision-making.